Concussion in sport and management is an area of debate in sports medicine. There's a lot of information out there that is opinion-based, specialist-based, but very few information that is evidence-based when it comes to the management of concussion in sport. Concussion itself is a functional derangement that happens after contact, whether that's contact directly to the head or contact anywhere else in the body, which transmits that force towards the brain. There isn't any structural injury in that. Most times imaging with CT scan or MRI would come back normal, but it's more of a functional deficit. Signs of concussion are actually quite common, from headaches to dizziness, blurry vision, sensitivity to light and sound. One of the more common issues that people think that needs to happen is that you must have loss of consciousness. You must have passed out in order for a concussion to happen, and that isn't always true. With regards to the management of concussion and having an athlete return to play safely, the guidelines that I use are what came out in 2004. In 2004, a group of sports medicine physicians, neurosurgeons, and neurologists came together and came up with what they call the PROG guidelines, which were through the second conference of concussion in sport. And in it, they've defined what concussion is and particularly defined a safe return to play guideline. In that guideline, it's management of really the serious sequelae that could happen with concussion that is allowed to return to sport incorrectly. And for a lot of high school athletes, management of concussion isn't always managed properly. And a lot of the times, high school athletes return to sport while they're still symptomatic. The main issue with returning to play while symptomatic is what's called second impact syndrome, when even the smallest or lightest hit can cause massive swelling inside the brain, which for those athletes who have had second impact syndrome, 100% of them have some long-term neurologic sequelae, whether that's slurred speech, inability to control limbs, or stroke-like symptoms. And half of the patients that have developed second impact syndrome subsequently die because of it. So management of return to play is quite serious, and if not picked up properly, could lead to serious long-term deficits. I use the PROG guidelines for return to play, which is a 6-step protocol which allows a safe return to play, and that only when asymptomatic, which means patients are no longer having those post-concussive symptoms of headaches, blurred vision, irritability, sleep disorder, that only then, after slowly progressing their sport-specific activity, will they be allowed to return to play. If parents want to know a lot more about concussions, there's a lot of information on the internet, a lot of good information, a lot of bad information. I think the best place to start is looking at the consensus guideline statement from the Prague 2004 conference. And if you just search it on any Explorer, whether that's Google or Yahoo, and just type in Prague, that's Prague, 2004 concussion guidelines, the consensus statement from that international meeting contains a lot of very helpful information, and a lot of information which parents may find useful in looking at their own kids, looking at their own athletes and their family, and seeing if they fall into those type of diagnoses or fall under the signs of concussion. And if they do, referral to here USC Sports. There's 2 primary care sports medicine physicians here who are well trained in managing concussions.